Hi, everybody. Good morning, good afternoon, or good evening, and welcome to the first panel discussion of the Global Digital Development Summit, Emerging Frontiers, Novel Data, Ethics, and Practical Applications. I'm Tyler Smith. I'm the co-founder and the Chief Technical Officer for Cooper Smith. Greetings from Malawi, and it's a pleasure to be with you all today. I'm joined by a distinguished group of technical experts. They all come with a unique perspective on use of novel data for public good. Let me introduce them to you now. Dr. Annie Chuama Mwale is the head of epidemiology and surveillance at the Public Health Institute of Malawi within the Ministry of Health. Dr. Mwale has been instrumental in the COVID-19 surveillance response, including overseeing data management, production of epidemiological situation reports, and providing daily updates and weekly reports for the entire country. She's also the chair of the Surveillance Subcommittee, a team of experts that generate policies and guidelines for the national COVID-19 response here in country. In these roles, she ensures that technologies and new data are properly harnessed to guide disease surveillance and response. Previously, she served as district medical officer in Malawi and as a Global Health Corps fellow in New York. You're most welcome, Dr. Mwale. Next up, you're very welcome. Next up, Kieran Sharpie-Schaefer. Kieran is the managing partner and lead data scientist at Palindrome Data. His focus is on the advancement of HIV services in public health through increasing the adoption and trust in established data science approaches. At Palindrome, his recent work focused on building predictive models for adverse outcomes in HIV programs. Prior to founding Palindrome, Kieran has delivered over 50 technology products in public health services in East and Southern Africa. In this work, he's found that the human issues around absorbing technology are usually much more critical than the technology itself, and usually more interesting too. Welcome, Kieran.
Thanks, Tyler. Appreciate it.
Mark D'Azalea, since 2009, has supported the President's Emergency Plan for AIDS Relief, or what we all know very well as PEPFAR, in a number of health information systems related roles, both within the Centers for Disease Control and Prevention, as well as the PEPFAR Coordination Office at the US Department of State. He currently serves as the Information Systems Team Lead in the Program Results and Impact Monitoring for Epidemic Control Unit at the State Department. That's a mouthful. He manages a team based around the world that supports all aspects of PEPFAR's centrally supported information system stack, including a global DHIS2 implementation. Mark and I used to work together many years ago, so it's nice to be together again in this forum, albeit virtually. Welcome, Mark. Sveta Mulesheva is an economist at the World Bank in the Development Impact Evaluation Department, or the catchy acronym DIME. She leads the IE Connect program of impact evaluations focused on transport investments, and within this program leads the work on urban mobility. Her research interests include information on communication technologies, population mobility, health, and gender. In particular, she focuses on the application of new big data sources, such as mobile phone data and crowdsourced data for impact evaluation. Welcome, Sveta. I'd like to start this session with some quick framing, and then we'll jump into a discussion with our esteemed panelists here. We'll reserve time at the end of the session for audience Q&A. If during the session you think of something you would really like addressed by our panelists, please use the Q&A feature of Hopin located in the chat box on the right of your screen. And I'm just going to pull up a brief set of slides here for us. A recent global report synthesizing data from multiple sources estimates that there are over 5 billion phone users. That's roughly two-thirds of the global population. And further, over half of the world is accessing the internet and using social media. This is as of early this year. Obviously, the trends are up here with mobile data use steadily climbing and hundreds of millions of new web and app users added every year. Many of these new users are low and middle income countries, and this is partially due to expansion, dramatic expansion in cellular networks and high-speed services that are available in these countries. In addition, smartphone penetration is also deepening quickly, which is going to unlock a lot of potential opportunities for expanding digital services in LMICs, but also dramatically expand the amount of data that's captured about people and their behavior. When you think about the amount of personal data that's generated each day, it's truly staggering. All the mobile calls, the text messages, the photos posted, the files shared, cumulatively have generated an estimated 44 zettabytes of data stored. That's 18 zeros and rather mind-boggling for me, especially when you consider 90% of this has been generated in the past 2 years. We know all of actors and industries are really clamoring to make use of these data. They see it as a really rich source of information. This includes everything from marketing agencies who are looking to optimize advertising campaigns to national governments who are trying to identify public health threats before they happen. But of course, not all of these actors have pure motivations. Numerous examples of unintentional mishandling of information like data breaches or negative consequences associated with interpretation, like poor individual or group outcomes from use of algorithms for decision making. There's also the nefarious actors who are looking to actively sort of take data from people and use it for their own gain. So given all of these challenges, obviously there's been this push to have better data governance and legislation around data privacy and standards for storage and use. And while the world is trying to catch up with effectively implementing these policy standards, many countries in which we work haven't quite defined the standards or fully operationalized them yet. And so we're thinking about more practical methods for assessing risk and establishing these ethical guardrails for how we would make use of these data while minimizing harm. This does create a bit of a gray zone for countries and support organizations who are looking to harness these data for public good while minimizing that risk. So at Cooper Smith, we've been working for several years with the Ministry of Health, regulators, and telcos to leverage anonymized subscriber data from mobile networks to inform decisions on the location of new health services and to improve the epidemiology models for COVID-19. We, of course, would like to continue to develop use cases and partnerships that can expand the implementation of these data and their benefit, but obviously ethical data use is our primary concern. Towards this end, we've convened along with the Georgetown Ethics Lab a panel of experts, bioethicists, digital health, HIV advocacy, and data scientists to help us think through what some of those guardrails can look like. A quick plug that proceedings of this convening will hopefully be coming out soon, so keep an eye out for that. But in the meantime, we need to continue to have this discussion. How should we think of personal data generation and privacy in the context of public good? How can we use these data as responsibly as possible while minimizing the risk to individuals and groups? And do emergency situations like COVID-19 constitute special circumstances for tapping into this type of information? These are really the themes that we broach with our panel today. And with that, to kick off the discussion, first going to Dr. Mwale. So, Doctor, you've been really at the center of the COVID-19 response here in Malawi. And I would like it if you could tell us a little bit about how you leveraged new and existing data sources, particularly individual data for case management, for public planning, et cetera, and some of the challenges that you experienced here. For example, were people worried about providing these data, and how did you respond to that?
Thank you very much, Tyler. Indeed, I've been working with COVID data in Malawi since the onset, when we first identified the cases in last year in April. And we've had several challenges, in particular, getting to use the innovative technologies to obtain data for management, not only case management, but for surveillance purposes, as well as for follow-up of cases and contact tracing. So one of the system that we're using for COVID-19 surveillance is the IDSR, Integrated Disease Surveillance and Response System. And when COVID was coming on into the country, we had been working on electronic IDSR, where we were going to use a digital platform to be able to capture data for any notifiable disease that may come out in the country. And COVID-19 coming on sort of catapulted the whole scale up of the One Health surveillance platform. And but because of the uptake in terms of utilization of this platform, we still use a paper-based system as well. I'm bringing up the One Health surveillance platform because this is a platform that we tried to use to be able to capture the data from people coming into the country at the points of entry, from any suspected cases that we're identifying in the communities. And we had a very big challenge in terms of trying to capture this data for people that are coming into the country. For example, people not giving in correct information, and we do not have any backup in terms of how we can verify that this data that people are giving is actually correct data. And this leads to impacting us in terms of the response in general, because if we cannot follow the people, if we're not able to get this data in real time or close to real time, and then we're not able to curtail the transmission as people go out into the community. We did try, maybe not for individual data use, but using the mobile networks data that the digital team did come to us to see how best we can use this. But of course, there's reservations in the general population in terms of capturing this mobile network data, what it means, the perceptions that people have. So this is not like a very clear area that we can just use this data, even though we want to use it for the public good. So those are some of the challenges that we've been facing. But one major issue that we noted as we're responding to COVID-19 was that there's a huge gap in terms of getting data, especially local data. And we need to invest as much as we can in the data management for us to be able to get, even for our modeling, our epidemiological models, just to get correct input that can actually inform our response better. We noted that there's that gap, and we need to improve on that. Thank you, Tyler.
Dr. Mwale. Moving quickly to Sveta, so your work partially focuses on how to leverage routinely available, truly big data sets like mobile network data to derive insights for improving public services and social programs. And you've talked before about your work with what's called call detail records produced by the telecommunications providers. Could you briefly explain to everyone what's included in the call detail record? And what do you really see as the major benefits of tapping into this potentially very rich and detailed data?
Sure, thanks so much, Tyler. So when we talk about call detail records, the data we're referring to is the metadata. So no information on what's in your text messages or phone calls, but really it collects information for billing purposes that the companies use that has information on the time and the tower that a call is linked to, and then an ID for the user. So then you can potentially follow an individual user and see if they're making a call from one district, and then you're seen making a text message from another district. And so then it's possible to infer that mobility has happened. And this is the data that then can be aggregated to allow us to better understand population mobility patterns. Now, obviously, the individual data is very sensitive, but potentially when aggregated, it can be used in a safe way that can provide exactly the type of information that Annie was mentioning would be extremely helpful for health and for health policymakers. Now, the way that I've worked with this data, so actually even before the COVID pandemic hit, that there's sort of a small group of researchers working and seeing how this type of data can be used for looking at spread of disease, because as people travel, they can bring any disease. Even what I had been working on was actually looking at malaria, which we usually don't think about as a infectious disease since it's not person to person, but requires a mosquito. But even if I were to travel somewhere, I could infect a mosquito that could then infect more people. And so when we're thinking about trying to eliminate a disease from a location, such as malaria, it's really important to understand if people are potentially continuing to bring that disease, because then that's going to counter the efforts that are being put in place to try to eliminate it. And the way that this data is extremely helpful is that actually understanding population mobility and tracking population mobility is really difficult. So before having this type of big data, we would have to rely on, say, census data, which in some countries may not have been available for 10, 20 years. And we know that mobility is very dynamic. And so even looking at the long-term migration patterns may not actually show us all the movement that's happening between locations. And so that's where this type of big data is really powerful in allowing us to see at a high temporal and spatial resolution how people are moving around. And then we can think about which are locations that may be at risk. And so we've now seen this with the most current COVID pandemic as sort of this type of data and these types of analyses have actually entered the more popular culture. We've seen them in news reports. And we can think about, if you have a disease start in one location, if you know where people from that location travel to, then you already know where might be the next places that will be hit. And you can already think about preventive measures. You can think about how you can try to mitigate that spread before it actually is happening. And that's why this type of data is really important, especially at the very beginnings of a pandemic, so you can try to limit its spread. But again, I think we do want to be very careful in how this data is used. While obviously even having individual level data can provide a huge amount of information, especially for surveillance and for tracking, using it in that way, I think is quite difficult and brings into question a lot of privacy concerns. And so I think that even using it in a very aggregated way where we can be very careful about privacy, we can make sure that we're not releasing any data that would identify any individuals, can still be extremely informative and useful. And so I think it's kind of finding that balance of how do we use this really rich data in a way that balances privacy with also some of these use cases where the data can be used in an ethical way.
Thank you, Sveta. That was very helpful. And I think you cue up a really important concept that's gaining traction right now, something that might be referred to as spatial epidemiology, or having much more granular information about how disease spreads for specific populations in a particular time and place, and thinking about how that changes over time. Mark, you are the data systems portfolio manager for the largest health program in history for a single disease, PEPFAR. Obviously, over the past few years, PEPFAR has pivoted actively and unrelentingly towards a data-focused and evidence-based approach. And this definitely has a strong focus on the geospatial component. You've made tremendous investments in data systems and generating these types of data across so many countries worldwide. I'm wondering if you could talk a little bit about the role of this increasingly more granular geospatial data, how it can and should be used? What are the potential drawbacks or caveats that people need to keep in mind?
Thank you, Tyler. And so it's clearly from the last 7 years within the PEPFAR programs, we've focused much more specifically on understanding where we're delivering services or care to beneficiaries or patients. There has been a concerted effort in standardizing essentially how we're describing those areas where we're delivering care. That coincided directly with the decision within this program that preceded that more granular data collection, the more frequent data collection that we do within the program. And a lot of what we're doing at the headquarters level, of course, we're looking at aggregate data that are fed by a variety of data sources that I imagine we'll talk about later in this panel. But I think on the geospatial specifically, as we were looking to do that, of course, we had to be thinking about a system and a process that would allow us to do that routinely. And so there was a decision made very early on by my predecessor to select the DHIS2 platform, which was already being used by many ministries of health, many NGOs around the world, and was serving, I think, as the de facto, and still in many cases does, as the de facto health facility registry in a given country. You know, there's a way you're describing the facilities and the geography where those facilities lie, and that becomes really a representation that's used certainly by PEPFAR and many other organizations that describe the geopolitical relationship between different facilities, different organizations. And so we maintain essentially a registry in our implementation of DHIS2 that has tens of thousands of facilities from lots of different countries. And over the years, we have sought, and always from the outset, to be very transparent about that data set. I think the selection of DHIS2 was also intentional in saying, we don't want to collect a bunch of these data in a proprietary USG system and then those data be captive and not be useful for anyone. Because really so much, and Sveta mentioned the word that I really wanted to lean into here, is metadata. And the importance that, the standardization about the where we're delivering services, and I'm sure we'll get to the who and the how and other elements of that, but all of those metadata that describe the where we're delivering services, or where individuals are moving, or all of that is so critical. And within PEPFAR, again, we've talked a lot about the sort of geopolitical hierarchies and how those are aligned, how we describe facilities, and how you can make investments in a registry that other disease areas can use as well. So the investments certainly within PEPFAR have an HIV, tuberculosis, and a malaria focus, but the description of a place is certainly not disease specific, and that same metadata can be used by other disease domains as well. I will just say on that, what we have learned, and I can speak to at far more length than we have time for here, is the governance around that. How you're describing, what standards that looks like, who has access to that registry, who maintains it. But absolutely, there's no going back. You can see behind me, right? Like, we think about maps, it describes so much of how humans interact with the world, and increasingly being able to do that in ways that are consistent from organization to organization. I think it's just an absolute no-brainer, but those standards around the metadata, how we structure them and how we share them, I think are critical for any program moving forward.
That's such an important point. And I think keeps coming down to metadata in country every time that you want to do an analysis, trying to pull data from different data sets. Even when you have a registry or something, it continues to be a challenge. So curious to also learn your thoughts about how we can harmonize some of these systems and processes going forward. I want to turn briefly though to Kieran. You're a data scientist, and often you're focusing on populations who are at risk. And I've seen you post a lot of perspectives over the years about exercising caution when you interpret data for policy action. So whether it's sparse data trends like we saw for COVID-19 in sub-Saharan Africa, or bias that might be created in some of these machine learning or artificial intelligence applications. So obviously there's this big tension that's going on in the world right now. As Mark was saying, having these metadata and these standards opening up data across sources, but then there's this persistent fear, I think, by governments and analysts and stakeholders that the data could be misused or misinterpreted, and then we would see some sort of negative consequence as a result of not having the full understanding or nuance or complete picture from those data. Could you talk a little bit about this tension in your work and how you see the world? And what are some examples of how we really need to be sensitive to bias or fairness in the way that we're harmonizing and integrating analytics for these data?
Yeah, okay, thanks, Tyler. I think you asked me two questions there, one about the tension, the balance between the risk and also the privacy and the impact, as well as the question around bias. I mean, I think I'll first start talking about the balance, because I think you started your presentation with a lot of data is being generated, and I think in all these countries that we work in, there's a huge amount of data being generated, and you talked about minimizing risk. But at the moment, most of that data is being used by the private sector to sell people things. So Facebook can deliver targeted adverts to people, whether they're in Nairobi or New York, wherever it is, and they're using that data every day. The cell phone companies, Spets talking about this fantastic data, seeing people moving around, populations moving around. The mobile operators, they can use that data every day to open new shops or new products in different areas of the country to offer services and make money. That's certainly fine. But they can do that with kind of pretty real time and responsive attitude to these things. But when the government or Annie or someone in epidemiology needs to use that same data to surveil the outbreak of COVID or SARS or whatever the next thing is, our sector struggles so much to even comprehend that is possible and ethical. So for me, I feel like, we talk a lot about minimizing risk with data, but why aren't we talking about maximizing our obligation given the dollars that have been spent, particularly on this continent? And most of that money kind of goes towards reporting. It doesn't really go towards these innovative epidemiological approaches that Sveta and Annie have been talking about that they need to do for the disease burden on the ground. So I think, I want to start talking more about what can we do, what is our maximum obligation. On the other side, where you were asking about what are the best practices, for that balance, I think they're really well established. I think that academia have got really strong established processes for identified data and de-identified data. Identified data you need to get ethics for, and de-identified data you can do certain types of analysis, whether it be on the metadata or be it on attributes on anonymized individuals, which I think this sector needs to get more comfortable with, again, because Facebook does it every day, and we need to get after it a bit better. I think the other thing is the private sector has these roles quite well enshrined, and it's in legal policy already, like GDPR, POPI in South Africa, and they talk about really, really well-established roles, like the data controller is maybe the health facilities who are collecting the data, and the data processor are folks who are maybe doing statistics and analyses on anonymized data sets. So, I actually feel like these best practices are out there. It's our sector that kind of hasn't figured its head around how do we, adopt these established practices, but also how do we talk to our stakeholders in government or the local population about what we're doing. We maybe do a lot of video calls about it, but I don't know that we're actually out there advocating for these approaches as much. That was a little bit of a long answer, Tyler. I don't know if that made sense.
Thank you. That was perfect, Kieran. You queued up some nice additional points for conversation here, but also I really love the phrase maximizing our obligations, which is something we should really consider in all of these debates. I want to turn back to Sveta, actually. there's a difference between getting ethical clearance or having an ethical conversation about whether you should do analysis and then being able to execute on that, and also public perception or stakeholder perception of that analysis. And we found that even though something could be considered ethical, it doesn't mean that it's palatable to populations who are affected, particularly thinking of something like mobile network data, where there's not explicit consent provided for when someone's records are then taken for whatever purpose, whether it be altruistic or not. So I'm just curious, from your perspective, what do you think are some of the ways we can communicate better with general public or with target populations about use of these data in a way that's also understandable? Because the work that you do is very esoteric and it's highly technical, and it's hard for me to wrap my head around it, and pretty much anyone else who comes across it. So how do we take those concepts around privacy and security and encryption, things that would make people feel safe about having their data accessed and used, knowing that it will lead to some benefit in the future? How do we better communicate that in a way that's understandable?
That's a great question. I think something that we are struggling with. And I think there's kind of two levels that we need to think about in terms of education and in terms of kind of providing that information. So one is on the stakeholder level. So even in kind of trying to do this work around COVID, I approached around 41 countries kind of through this whole process in trying to access this data and trying to work with this data. And a lot of times, the hardest part was convincing the government that this was something that they should try to do, that this is something that they should engage with, that is interesting, and that can help them. I think that we need to do a lot more capacity building and a lot more work in terms of sort of showing what is the power of this type of data, how can it be used, and how can it really be applied to policy. So I think really until the current pandemic, a lot of this work had been very academic, a lot of research produced, but not as much really applications to policy. So I think the more that we can try to build that knowledge and capacity within government so that they themselves can see what is the value, how can this be used, I think that's kind of a first step in kind of starting this process of being able to sort of integrate this data into the day-to-day, the way that DHS data is used and census data, and sort of see this as just another type of data that can be extremely useful and powerful, especially in these sorts of situations. Now with the public, I think it's quite hard because even when the data is being used in an aggregated way, when it is fully anonymous, where I don't see any individual level data, I think there is sort of this worry that people may say that that their data is being misused, or there's all sorts of perceptions around this, especially when sometimes data can be misused and has been potentially used in ways that are not appropriate. And so I think that again, trying to demonstrate safe use cases, also thinking about how we can try to have consent. So the way that companies have terms of service where they say that they're going to use this data for business analytics in an anonymous way, and people just click that and say, sure. I think we can think about, well, how can we start to integrate potentially public health uses or other types of uses where, again, we're working with the data in an aggregated way. And I think, as Kieran mentioned, there are systems that have been developed for how to work with this data safely. For example, this data doesn't have to necessarily, the raw data doesn't necessarily have to ever leave the company. It could stay within the company where it's, again, already being analyzed by data scientists within the company, but instead we can ask them to produce algorithms and to run algorithms that can produce this aggregated data that can be used the way that we use census data, the way that we share these other statistics. We can produce similar types of statistics with this data and kind of do it in a way that's very safe. Now, again, how this gets communicated to the public, I think is difficult. Trying to have more, I think, discussions on this and a lot of transparency around how the data is used is really important. And then, I mean, from our side, we've been trying to kind of blog and produce outputs that are very easily digestible. So instead of just doing kind of academic papers or long reports, trying to think about ways that that are more digestible for people. Also like dashboards, visualizations, ways in which people can really interact with the data more, I think are also helpful in doing this. But I think it's going to be a long process, but hopefully we're moving in that direction.
Great, thank you so much. Dr. Mwale, you were in the room when these conversations were taking place in Malawi, a very practical example. In this case, there was the availability of these mobile network data. It seems to be that there was definitely an understanding of the use could be valuable, but could you take us into those conversations a little bit? What were some of the issues that were being debated? What were some of the concerns about ultimately going down that path?
Yeah, thank you, Tyler, and thank you, Sveta. I think you really hit the nail on the head in terms of use of this data and understanding the importance. So for Malawi, when this was presented in terms of how we can use the mobile network operators' data, most of the forums where this was presented actually welcomed the idea to say we can use this in the response, but the main concern was the ethical consideration, because to get the understanding that we are only looking at a group or an aggregate data, looking at how maybe people are moving from one place to another, and to say that we are not tracking people, it's something that we need to spend a lot of time with not only the public but also the government office to understand if that really is what is happening, because you know, this technology innovations, it's not everyone's cup of tea. We don't know what goes on behind, and with a lot of information that people are able to see, say in movies or on the news, trackers being placed and all that, there's a lot of that going around, and people are prone to think that maybe this is the government is trying to do. And the other thing is the issue that you brought in as well, to say the mobile operators are already have access to this data and they're already using it, but you find that most of the people actually don't know that these mobile operators are accessing this data, and they can already do these analysis that we're trying to do. So also coming from a background now within the government office, as a background where sometimes data has been obtained for a particular reason and it's being used for a different reason, that trust to say this is indeed going to be used for this, we need to work on that for us to actually be able to use this kind of data. And so, yeah, maybe the only other thing that sort of hindered us moving forward and utilizing this to the maximum was the fact that it was not real-time data production, because like I say, we're using aggregate data and we have to analyze it at the end of the day. But for us to be able to follow and have like a real-time intervention that most people wanted at the time was like, are we able to track someone who is supposed to be in quarantine, for example, and they're moving out of their house and do that. And that is something that will need consent from the person. And the whole process of that is just something that needed a lot of time. And I think we're still trying to work around just accepting the aggregate data and the mobile, from the mobile network operators data. Thank you.
Thank you for that, Dr. Mwale. I think one thing that seems to be a persistent theme is consent, and what that actually looks like on the ground, how you do it feasibly, given some of these data sets are quite large, and you're far away from the individual at the point of data generation. Not all sensitive data sets, however, are large. PEPFAR in particular, I think, does a lot of work, Mark, to target populations who the country believes is most at risk of acquiring HIV, looking at how to provide them with interventions that are not necessarily clinical, so more structural support that is not inside the formal health system, for example. And I know there's been a question for many years about how you would build the data around those interventions in such a way that you could link the different services that these and you would link to their clinical records. So we would be interested to know what services someone accessed, what stack of services or layering they were provided, and then ultimately what was the clinical outcome. Were they seroconverted, HIV positive, and then sort of what happens downstream from the clinical cascade there. And I don't have the latest on this, and so I know that this involves some sensitive populations and some sensitive data. And so I'm just curious if maybe you could talk a little bit about how PEPFAR has dealt with this issue of consent and communication with these populations, and what sort of protections are put in place to ensure that you're able to use these data in our obligation that we need to maximize data use, as Kieran would say, but at the same time, making sure that no one is potentially harmed in the process.
Yeah, thanks, Tyler. I think it's an excellent question. The HIV epidemic has evolved over the decades. We're so fortunate that we can essentially manage an individual who is infected with HIV as a chronic condition, as long as they are retained on antiretroviral therapy and maintain and maintenance of medication. They can live long, productive lives, and that's evidenced. Our annual planning meetings are happening right now virtually. Really an interesting experience, but we hear an emergence over the years of additional interventions necessary for these populations, including aging care now, which is a really interesting, and I think it's a testament to the program that we have individuals who are in need of aging care. But this, of course, as we refocused the program 7 years ago, doing the right things in the right places at the right time, knowing it doesn't make sense to blanket the same offering of services throughout an entire country where those populations are different, their HIV epidemics are different. And so really we have had to shift, and the data, the governance, the systems have not been there as the sort of leadership approach was shifting, to think of how you manage the disease as an individual level disease that you're managing over time. And that relies upon something more than aggregate data. I think where those data are used is so critical. I don't know that you need individual level data in Atlanta or DC or Geneva or wherever that may be. But I think just as I was talking about the importance of standards around the metadata, the ability for those individual encounters, whether that's it's a case report for someone reporting to a clinic, that's surveillance activities. If we know it's not complicated to move an individual record to an aggregate, it's really just agreeing on sort of the standards about that. And so we already have a lot of individual level data collection within the program. That's been happening since the inception. There have been different ways to try to track this. A lot of those paper-based, a lot of different electronic interventions, a lot of very well-intended approaches that we're considering. I think, as Kieran is actually saying, like, how are you balancing that risk versus the benefit? We sign off, I couldn't agree more, to social media, to a variety of organizations, to allow not only our data, but the way in which we're interacting with that platform to be collected and used to inform the platform, to do a variety of different things. I think what we're really finding is there's a greater awareness. I think in COVID particularly is making people, I think, even more aware of how much they're relying on digital platforms, how much they're sharing with those. Organizations, from governments to academia to private sector, they've all had to think about how they're sharing, how they're protecting. But I think we all know there's no going back in a lot of ways here. We provide a lot of technical guidance. I think what we've really found is that if we think specifically about our key aggregate data indicators, we call these the monitoring, evaluation, reporting. Historically, those sorts of data calls have always come in sort of narrative form. You get some qualitative interpretation, and then you get 1,000 different partners trying to reinterpret, like, how do we actually code that in our paper-based system or electronic system? And it's so inefficient. And so I think thinking about ways to advance the development of guidelines within organizations like PEPFAR, WHO, others, where you're thinking about how they need to be implemented. What types of people would need to read this and do something with that. It forces a lot more design on the front end. It forces organizations like PEPFAR and others, and I think we have a track record of, yes, we've had to build some parallel things, but we also recognize there's an opportunity to strengthen if others are doing what PEPFAR is doing here. So I just think on the individual level, specifically balancing that risk and reward, I think there's a lot of sensitization around these big concepts about digital transformation, generally how you're using data, how exactly, as Dr. Mwale is talking about, the considerations you make in an emergency. And I think there's a couple of programs. PEPFAR has been fortunate to be able to support an activity called the Digital Health Applied Leadership Program that's really looking to bring sort of cadres of individuals in more senior positions in ministries and governments together through skill building activities where they can think about these big issues affecting their governments and then tailored approaches to how they implement that, and really reorienting programs like PEPFAR and others to be more adaptive, receptive to those needs in country. Because we know it's to do this right, you have to have trust, you have to have buy-in, and that's so important. I think people who manage systems and do management and governance, there's so much trust placed in us, and we realize how fragile that is. And so trying to make sure that there are sort of systems and policy interventions to support what are just, I think, people doing what they think is the right thing to do, but we need some more there. I could speak a lot about this, but I did just want to mention on the guidelines specifically, PEPFAR has been supporting great efforts coming out of WHO on the SMART guidelines. This has been called Computable Guidelines or Intelligent Guidelines in the past, but essentially the acronym for SMART, it's standards-based, machine-readable, adaptive, requirements-based, and testable. Essentially saying, we don't all have to choose the same systems, but we should start aligning on how these are collected, how they get implemented, because so much what we're doing in PEPFAR right now, and I'll plug one more thing, we've been championing this data use community, and it's very much a community beyond PEPFAR as well, but if we really want to scale the things we're doing, there are a lot of considerations from policy to the actual implementation guidance that we need to be thinking about from a lot of different perspectives, and so much of that is just vocabulary and how we're talking, how we're exchanging information about this. So we're working through a lot of these issues and that vocabulary, how you approach these conversations. But Tyler, yes, I mean, individual level data collection is happening. It's happening. And I think it's how do we make sure that we not stop it, but we make sure that there are ways that these can be shared in impactful ways that reduce the impact on data collection, maximize the impact at the local level, but also allow programs like Global Fund or PEPFAR or others to get the aggregate data they need to manage their programs from those encounters as well.
Thanks, Mark. That was all really helpful. I mean, I think getting on the same page about terminology is part of the biggest challenge that we have in implementing any of these standards, or with coming to common ground with stakeholders and who we might be generating data from. I think just to remind everybody, we've got some time left for questions. There's one or two that's been posted in the chat, also the Q&A tab on the right there. So if you have any questions, please go ahead and drop it there, and I'll be able to send it to the panelists. I think while we're waiting on some additional questions, I wanted to go back to Kieran and ask you what you're most excited about going forward. So what are some of these new frontiers in data and analytics that are most exciting, we should really have our eye to the horizon on?
Okay, thanks, Tyler. I think the one thing we believe at Palindrome is that the data is there, and that there isn't like some magical new system that we need to build that now collects everyone's labs and clinics and all that stuff together. So the one thing I would say is the data is there. Like we've heard about the telecom data, the pharmacy data, sales data, that those things are there. They are in different systems. So I think what's going to happen in the future is can we get the capacity locally to bring these data sets together, even if it's a once-off analysis, and process that data locally to find the local insights. And what I'm most excited about is that the bar has been lowered a lot on the data science side by all these online courses around data science in South Africa. They've got several academies for data science. We've just hired some folks from these academies. And I think they've really lowered the bar to get this data science capacity locally from these local countries, not just relying on our West Coast or East Coast friends in the US perhaps, but local data science is working with the epidemiologists like Annie and her team, who've got the classic MPH epidemiological background combined with these hot new folks who can process a lot of data and look at different non-classical processing techniques, like these black box techniques and these kind of things. So I think that's an interesting time now where we might be finding more kind of like evolved states of epidemiological research with local programmers and local data scientists.
Thanks, Kieran. I've certainly seen here in Malawi and the surrounding region a massive uptick over the past few years in people that have this skill set, and so that's quite heartening. Turning it over to our Q&A, I think there was one question that came in first for Sveta. Are there data sharing agreements in place to use these data? I presume we're talking about the mobile network data. Who has access to the detailed data and metadata?
Sure.
Yes.
So yes, I think data agreements are really critical in this space, and we do have data sharing agreements with all of the telcos that that we work with in different countries. But the data itself, as I mentioned, I think one of the safest ways to work with it is that the data stays at the company. So you don't actually transfer the data, it stays there, and instead you can produce the algorithms locally. And now, as Kieran mentioned, the technology has become a lot easier to be able to work, even if you're not necessarily a data scientist, to work with kind of programs like Python without having to necessarily learn kind of very complicated big data programs, but things like PySpark, using Docker, all of these technologies have made it possible to then kind of produce the algorithms locally and run them on the machines within the telco. So then all that comes out is the aggregated data, which again is one way in which we can make sure that privacy is preserved. There's also a lot of other techniques in which we can do that in terms of limiting if there's observations below a certain number, that those are not shared. There's all sorts of new ways in which we're working so that this can be done safely. But again, it all starts with a data sharing agreement. and also something we haven't mentioned, but also the role of the regulator. So in all of the countries where we work, it's important to not just be in touch with the telco and get their agreement, but also the regulator needs to be on board, and they can provide their approval in terms of making sure the data is used safely. And so again, that's kind of another layer that helps in terms of use of this data.
Thanks. That was really useful and a good segue to the next question. I'm wondering if Dr. Mwale, you wouldn't mind fielding this. What role can government play in bringing the telcos on board in a more regulated manner to make mobile network data available as a global public good? Do you have?
Yeah, just a bit, just to say that I has a great role that can be played, especially through the regulatory authorities that most countries will have. Like for Malawi, we have the MACRA, and if we're able to monitor and regulate what sort of data people are able to use from the telecommunications companies, and we're able to maximize, if I may, adherence idea of looking at how best we can actually use this and making sure we build capacity within the government system and have people be able to identify how best we can maximize, and then allow the regulatory authority to allow the citizens or anyone that may be interested with, of course, proper procedures that need to be followed, so that in the end we are still protecting the people, and we're still protecting the privacy of the individuals, and we are only using this data for what it is intended to be used for, to help the countries.
Thank you, Dr. Mwale. And I love this last question from Catherine, who says she always likes to hear calls to action from the panelists. And she'd like to know what's the one thing that you would like funders and implementers to do to maximize our obligation, as Kieran stated earlier. In just a couple of words, closing us out for the day, do you want to start, Mark?
Man, I would say, really think about moving beyond the color of the money. That really goes more to the funders. So thinking about a project or the protection beyond your slice, beyond your 1 month of activity, and thinking about what is the long-term impact of what I'm collecting. Are there things that I can leverage already in that environment? It's already out. The principles for digital development. It's well described.
Thanks, Kieran.
Sorry. Yeah, one thing I think is I think the smaller implementing partners, the technical folks, and even the NGOs, I think I see they need a lot of help on advocacy for these new approaches with government, and that's almost like saying to the government, look, we'll help share the risk with you here, and help on those advocacy fronts, as well as the second thing is incentivizing the implementers in a country to actually collaborate, because generally, each implementer will get their own little data sets and be quite protective of that. And if they could be incentivized a little bit more to play nicely, that might help all of us get along a little bit better.
Love incentives. Sveta?
So this speaks to Mark's point as well, but I think sustainability. So oftentimes we've seen these kind of short initiatives where you get funding for 6 months, you get funding for a year to do this project, but it is costly. Even though the data technically exists in these companies, it's still costly to access it and to analyze it. And so thinking about what are longer term streams of funding that would allow this to continue, so it's not just a one-off, I think is really critical.
Absolutely. And last but certainly not least, Dr. Mwale, what would be one thing that you would tell funders and implementers?
I'd say contextualize to where they are putting the money in, understand what the culture is, understand what is going on and what the challenges are, for us to be able to address those and use the data maximally, and at least then we'll also ensure some sustainability with that.
Great. And that's an excellent place to wrap up. It's been an exciting and interesting conversation. Would like to thank all of our panelists and thank the audience for tuning in. I am supposed to make some closing remarks, just to say that this is the last session of the day, and you can visit the expo area to meet the vendors and also watch pre-recorded content. So hope you tune in tomorrow and look forward to seeing you soon. Thank you.